Today on Community Watch, I talk with Sarah Hunt, who is the program coordinator for the metabolic and bariatric program of Advent Health-Redmond. It's a fascinating show, really interesting. You learn a lot. Sarah Hunt is also a Georgia Highlands alumnus. You gotta watch this one. Community Watch starts now. Welcome to Community Watch. I am very happy to have with me today as my guest Sarah Hunt, and your title, if I can get it right, is Metabolic and Bariatric Program Coordinator. Those are big words, at least the metabolic and bariatric part, for Advent Health-Redmond.
Hi.
Welcome.
Thank you. It's nice to be here.
And I don't want to get too far without acknowledging that you got your associate degree in nursing here at Georgia Highlands.
I did. I graduated in 2010.
2010. Now see, that probably seems like a long time ago to you, but it's like yesterday to me. So, and then you got your bachelor's degree at West Georgia.
I did.
That was, I'm assuming, before we had that opportunity here at Highlands.
It was. We did it through a joint venture with the University of West Georgia, and they would come here once a week for us, and it would made it super easy. I loved the program, and I was able to get my bachelor's degree the year after I graduated with my associates.
And you have a master's degree too?
I do. I just got that in 2022. I graduated from the University of Central Florida.
That's great. So you have plans for a doctorate yet?
I never want to go back to school.
You know, I said that too, but I did anyway. So
maybe one day. You never know where the world will take you.
That's true. That's true. All right. So you need to help me with your job title and what your job is. Metabolic and bariatric program. Tell me about that.
So 2.5 years ago, Advent hired me to help build a bariatric surgery program and obtain national accreditation for that program. And we did that. So basically what I do every day is I help patients get from A to B, which A is beginning of the process for bariatric surgery, B is surgery. There's a lot of things that patients have to do in between all of that, and so I help kind of navigate them through that process. The other part of my job, that second half, is that accreditation piece. So essentially what I do is I help the organization meet a set of rigorous standards to ensure that we are providing safe, effective care for our bariatric patients while they're at the hospital and even after with supporting them.
All right, you help us understand, and I'm saying us, and of course I mean me, but what is bariatric surgery?
So bariatric surgery, you can simply just say it's weight loss surgery. I like to say, well, I'll just share my personal story. When I was 31 years old, I was diagnosed with diabetes, hypertension, high cholesterol. None of the things that anyone wants when they're 31 years old. I made the decision
or at any age.
At any age, yes. I made the decision to have bariatric surgery or weight loss surgery to help me essentially get rid of all those comorbidities before they became worse. I did that in 6 years ago, in 2019. I went from 300 pounds to now I'm 137 pounds, and all of my health conditions have resolved. I no longer suffer from those anymore. I don't take any medication every day except vitamins. So that's what I basically help patients do every day.
All right, we have to talk more about this. So the bariatric surgery, the weight loss surgery, that's a surgery that essentially makes the stomach smaller?
So we offer 2 different types of procedures here in Rome. We offer a sleeve gastrectomy, which is basically we remove 70 to 80% of the stomach, so that portion of the stomach that stretches when you eat, we remove that. And so you have a restrictive nature to your stomach, so you're not able to eat as much. It also helps with some gut hormones to help you feel satiated and full. The other procedure that we offer here in Rome is the gastric bypass, which is one that most people tend to know. It's the one we've been doing for the longest. And that's essentially where we make your stomach into the shape of an egg, you could say, the size and shape of an egg, and then we bypass a portion of your small intestines.
All right, so.
Which help you essentially eat less, absorb less, and lose weight.
So when that surgery is done, does it makes it physically difficult to eat more than a certain amount?
Correct.
Does it also make you less hungry?
It does. So the new GLP-1 medications that everyone's heard about, I like to say that the gastric bypass is like having a GLP-1 drip constantly in your body without the need of that medication. So it's a surgical alternative. Some patients can't tolerate the GLP-1, so gastric bypass and liver are a great alternative to that as well. Or sometimes, unfortunately, in conjunction with, that could also be the case.
So, and you had, which one did you have?
I had the sleeve gastrectomy.
And how fast? I mean, you lost just an amazing amount of weight. It's hard to even imagine.
I lost 40 pounds before I had surgery. I say on my own. I was following my clinic's recommendations on dietary changes, and then I lost about 100 pounds after I had surgery over the next year, so about 2 pounds a week, which is pretty, normal. And then recently, I've lost about 30 more pounds.
Intentionally?
Intentionally, yes.
I wouldn't normally ask these questions. They're so personal, but you used yourself as an example. Mm-hmm. And I'm sure people are curious how it works. I have a lot of questions. So these new medications that are now available, mm-hmm. Would you still recommend a surgery option rather than say taking drugs, or is it an individual kind of situation?
I think definitely every person's situation is different, right? Maybe a patient that has a lot of comorbidities, or they're not in the best health, maybe they're not a surgical candidate, mm-hmm. a medication could definitely be an option. I think there's lots of factors that go into that, and it's really important for you to talk to your primary care doctor and maybe even get an appointment or a surgeon consultation and start that process to talk to the experts about those things, because I do think it's individualized. I think surgery was the best option for me. Surgery is still the I guess you could say, most gold standard. It's the most effective tool for the treatment of obesity and all of the things that go along with that: obstructive sleep apnea, diabetes, hypertension. We could go on. There's a huge list. And so I really do think that's an individual kind of scenario that you have to talk to a professional about, for sure. For me, at the time we didn't have GLP-1s. A lot of insurance companies don't cover GLP-1s. And so, surgical option is also a great option as well.
And I wonder if we know yet about how effective those medications are. They're so new still. They are,
and they've been actually using them for years in diabetics. So there is some data out there, but these medications that we're using now are newer, so they're tweaked, more refined. But I agree, the jury's still out on the effectiveness and long-term use of those medications.
Yeah. There's so many individuals that are overweight. I mean, it's an
epidemic.
It's an epidemic. I've heard that word used.
Yeah.
For obesity, I guess we call it. Mm-hmm. Although that's an interesting idea too. How do you determine if someone is truly obese? What is the
So traditionally, we looked at BMI, but I do think it's important to understand that if we were comparing, an obese person to like a bodybuilder, they could have the same BMI and on a chart look the same, but in reality, one has more body weight related to muscle mass, and one has more body weight related to body fat. And so it's a tool that we use, but they also, physically examine the patient. It's important to kind of understand there is a differentiation there. BMI, chart is a great tool, but it's not the end-all be-all tool.
Yeah, yeah. It's we've had on the show before trainers and nutritionists who talk about how dietary choices are a major culprit in weight gain and just health generally. Processed foods, you hear a lot about those. When someone decides to have the surgery, the bariatric surgery, do they still need to make radical changes in what and how they eat? And
for sure. We do a lot of education with our patients on teaching them about nutrition. I think we have a problem in our country in general with just nutrition education. One of our surgeons, Dr. Scott, he said it really simply to me the other day. He's like, stay as close to that food source as possible, less processed things, staying in the outer aisles of the grocery store, not going in the inner aisles where all that highly processed food.
I hadn't even thought about that. So that's where they keep it all in the middle. Oh, that's interesting.
And there's some on the outsides, but mainly on the outside, you have the fresh fruits and vegetables, you have the things that have to stay cold for them to stay good. And putting a bag of chips in the refrigerator doesn't keep them any more expired, less expired than if you just left them on the counter. And so that's a really good, to me, simple version of that. Like, stay close to that food source. Shop on the outside aisles. Cook your food. Try to stay away from that processed stuff.
Well, that must be the hardest change to make for individuals. Whether they go, I don't know how the medications work, but certainly with the surgery, to be used to fast food and less healthy options always. And then shifting to, the outer aisle foods and cooking, I guess, your own food and being very careful when you go out.
I will say I eat differently than I used to, right? I have a better understanding. I've been practicing this for 6 years, right? And so I think that, part of it is kind of reteaching yourself things that you didn't know. I don't know half of what I knew 6 years ago. And it's kind of trial and error too. I didn't really realize there was so much calorically dense food and things that we eat, especially when we eat out. We don't really know what's in our food or what they cook it with. And so learning all of that, I still eat out. I just make very drastically different choices, or I say, no cheese, or I say no butter. I'm very open with saying, please hold those things. I don't want them on my food. But I think that was a thing I had to learn. I had to learn to read food labels, go on the internet, look at different restaurants, say, I can totally eat this, but I'm going to tweak it just a little bit. We actually have a support group that we do with our patients every year that talks about how can you eat out, because the reality is, right, we're going to eat out. Everyone's going to eat out. It's convenient. It's kind of the world that we live in. But how can we tailor that to make it more friendly to your meeting your goals?
Well, I was going to say it must be difficult for individuals that have to make that food change to find anything at a fast food restaurant. Although some of them are trying to provide salads. I mean, you can get a salad at Chick-fil-A now, so.
But sometimes the salad is just as bad for you as the burger.
You got to be careful what's on the salad. The dressings are.
Yes, exactly.
It's a trap.
Yes,
the dressings are a trap.
You're totally right. The Cool Wrap at Chick-fil-A is like one of my favorite things to get. But if I add that dressing, I'm adding more calories than the Cool Wrap itself. And so I just get buffalo sauce instead, which is like 25 calories, and I still have my Cool Wrap. So there's ways to do it. You just have to kind of do the homework, and then you know what you can eat.
Right. Well, we've got a little time left before our first break, and I know you want to talk about the your program and some of the events that are going on where you talk about this. But I do think that the surgery now is happening often enough. Do you have a sense of how, it's popular isn't the right word, but you're doing the surgery fairly often, I would.
Yeah, in the United States, we do about 280,000 bariatric procedures annually. That was 2022 data. And then we obviously do them in Rome. We have to have a certain amount of volume to be able to keep accreditation. So
Right.
both of our programs in town are accredited, and so we do have to have that volume.
That's a lot.
But actually, in 2020, about 170 million Americans suffered from obesity and severe obesity. Yet we only did 280,000 procedures.
Yeah.
So access to care is a problem. I think people have a misconception of bariatric surgery, but
that's
it
what
changed
you're
my life.
here for.
Yeah, it changed my life, and I tell patients I would do it again tomorrow if I had to.
Well, we have to take a break here, but we'll be talking much more about this when we get back, so don't go away. We'll be right back.
While being a student athlete at Georgia Highlands College, I get to compete at a high level, as well as be a part of a supporting community.
Wearing the Charger orange and blue is more than about just a game.
Now you have an opportunity to make a gift towards the Georgia Highlands athletics community.
Being etched in stone as a champion last year meant the world.
Bringing it home to my hometown, amazing.
Your generosity will provide scholarship dollars and enhance the student athlete experience.
Please donate to the Georgia Highlands Athletic Scholarship Fund.
Go Chargers.
Welcome back to Community Watch. I'm having a conversation with Sarah Hunt, who is I have to read this, Metabolic and Bariatric Program Coordinator at Advent Health-Redmond. One thing, we were talking during the break here, the condition that the surgery treats, being overweight or obese. You're dealing not only with the health issues of the patient, but there's a lot of psychological stuff there too. I mean, you're dealing with someone's image, self-image, actual image, but the way they think of themselves. I'm guessing once you begin to lose significant weight, that improves how you feel about things. I mean, it should, but there must be some challenges in getting people to the point where they decide surgery is the thing. I mean, that sounds like such a major move to make.
It is.
So I imagine you deal tenderly with people who are considering this and guiding them through that process.
For sure. It took me 5 years to make the decision, actually being diagnosed with all of those things, diabetes, hypertension, high cholesterol, for me to actually, I say, pull the trigger and decide to have surgery. I think that support for the patient, one thing that we do offer at Advent Health-Redmond for that patient is someone who has had that experience. I can relate to the patients. Our nurses are great on the floor when we support them after as well when they have surgery, but most patients have thought about this for years, and they finally either get diagnosed with something that they're like, okay, it's time for me to do this, or they physically just want to feel better. They want to get on the floor with their kids, or just tie their shoe, or maybe go ride a bike again, do something physical that they haven't been able to do, and that kind of helps them make that decision. But it's a very difficult decision, right? Because I remember I used to think, well, if I can't do it, without surgery, how am I going to do it with surgery? But I have this tool that if I use it right, it's going to last me forever.
I know I will come up with some more questions about this, but we need to talk a little bit about the success of your program and some events that you're involved in. So tell me a little bit about the accreditation process.
Yeah, the whole process.
Well,
No, I'm kidding.
no.
So our accreditation, we actually secured that accreditation in September of last year. It's something that we've been working on as an organization for the last 2 years. Best way I could describe it is if it's like a large book with all these rules in it, and you have to say, okay, this is this rule or this is this, standard. How are we as an organization going to meet that standard? And so for the last 2 years, we've essentially been creating wonderful processes and programs within the organization to help support that patient in that journey, not only while they're in the hospital and having surgery, but also after, how to support them. And that kind of is the brainchild behind the event that we have coming up.
All right, so you have an event that is very soon from this day when we're taping this, but some folks may see the show after the event, but this is an annual event.
It is.
So tell us about the expo.
Yeah, so last year we wanted to create an event for our bariatric surgery patients to bring local health and wellness experts from the community into one convenient location. So you can, if I wanted to join a gym, well, I can come to the expo and talk to 5 different people in the Rome area who own gyms or affiliated with gyms to see, well, maybe this one's the best fit for me. Or maybe I wanted to start chiropractic care, right? Who could I go and talk to at the expo? We have probably 4 or 5 chiropractors that are going to be there. So a very wide variety of not only, medical providers, but also support systems that are in our community. The Tread's going to be there. All different kinds of people to see, what does Rome have to offer me? Kind of like, if I'm going to the hospital, I have that support there, but what also am I going to have after? It's important for you to kind of know what other support you have in a health and wellness perspective in the community.
And that is on February 1st this
Yes.
year at the Forum.
It is.
Is that a Saturday?
Yep. Saturday, February 1st from 10 to 2 at the Forum. It's free for the community. We're going to be offering free health screenings as well during the event. And it's a no pressure atmosphere. So we are not allowing vendors to sell things to people. We really want it to be a really community information driven where you can come and kind of see, maybe I want to join a gym or maybe I want to do whatever it is. Come and see if we have it at the expo.
Yeah.
Come get your blood pressure checked. Come get your body weight and body fat percentage checked. We're also doing free diabetic foot screenings. Dr. Russo Lisi is going to be there. And so we really wanted to have added value also for the community as well with those
That's great.
screenings.
And this has become an annual event.
It has.
So do you have it about this time every year?
About this time every year. Just kind of depends on Super Bowl and all the other fun things happening during the time.
Well, for folks that aren't hearing about it in time to go this year, that kind of information actually is something that you offer throughout the year, isn't it? I mean, you can direct people to different places, and that's part of what your program does. So they don't need to feel like they're just out of luck totally. They could reach out, I'm assuming.
And we also have on our Facebook event for the actual event, you can see a list of all of the vendors that we're going to have. We've tagged as many of them as we can, and we'll update that list as well. So you can always reference back to that event page to see what vendors were there.
And it's you just look for the Health and Wellness Expo.
Northwest
Facebook
Georgia
page.
Health and Wellness Expo Facebook. Well, it's an event, but yeah. And then we'll have it listed. And then we might list some stuff on our website as well. We can maybe work on that.
All right, that's great. And I think you mentioned that you participated in some way in the event that the 100 Black Men have in the summer.
We do.
I don't know the date of that event this year, but they usually have it
August
sometime, and that's a big event.
It is.
That has grown over the years, so that's a really big event. So for somebody that is overweight, maybe they have begun to have some of the issues, perhaps diabetes, early diabetes, maybe. where do they need to go? I mean, what's the first step?
I think the first step is contacting your primary care doctor. If you don't have a primary care doctor, that we got to get a primary care doctor established for you. We have a list of primary care offerings in Rome and the surrounding communities in Tryon and Cedartown. And so we are definitely taking on new patients for primary care if you don't have one. The other thing I would, just get started with the process. You can go to bariatricsurgeryga.com and look at getting started with the process. What that looks like is you go to our website, you do an online information session. I would be in contact with you. We would get you to fill out intake forms, and then we would see if you have benefits based off your insurance policy. And then we would have just a conversation about that. We do try to support the patient through every step of that process, and that's something that we take pride in. We want to make it easy as possible.
Well, that's a big decision to make
huge decision.
Not only that kind of physical commitment, but also an entire lifestyle change. I mean, that's a big deal.
It is.
And it's going to be challenging, I'm sure. So those initial steps are critical. Is there an age range for the surgery? I mean, are there people that are just too young, or people that, I'm sorry,
No, that's a great question.
Ancient people like myself.
We don't do surgery. I'll give you just a typical range, 18 to 65. We can do surgery on patients that are older than 65. We just might have to get additional clearances and really look at their health status, right? We would do that really with any patient. If you are, an adolescent considering bariatric surgery, we would send you out to a center in Atlanta who does adolescent bariatric surgery. We just don't do that here.
Yeah.
Some insurance, policies have guidelines on that as well, but we look at all of that.
I would guess with a teenager, you'd have to consider growth and development issues as well. So
yeah,
there's a lot to it, but it's happening often enough here for your program to be accredited. That was part of the big book you had to fill out.
It is. Dr. Scott actually brought bariatric surgery to the Rome area over 20 years ago. So we've been doing bariatric procedures here in Rome for a long time.
Well, 20 years in the big picture is not, it's fairly recent in my universe, but I get that. I mean, it's established. It's not brand new.
Yeah, it's good that we don't have to go to Atlanta.
Right.
Who likes Atlanta traffic? No one.
No, but it sounds to me like part of your program is not just the surgery itself, but it's everything around it. It's kind of creating a community for these patients.
For sure. We just don't do surgery and say, see you later. We see you at set intervals after surgery. We support you with the support group. And so it becomes like a little community because we all kind of relate to each other in some way.
Now, I'm digging into this the surgery questions, but do individuals ever have to have a second surgery? Does that happen? Or
that's a great question. Sometimes with the sleeve procedure, so the procedure I have, you can think of your stomach as the shape and size of a banana.
Right.
Okay, you can have acid reflux with that, and that can be not good for your esophagus. It can cause issues, and so we do have patients that do have to have revisions. We do offer revision procedures. Revisions.
Now, see, as an English major, I appreciate that term. I do.
Revision. So if maybe you haven't had as much success with your primary procedure, or you have an old lap band. We don't do lap bands in this community anymore, and you've had some issues with it, we can convert you to a better tool.
Need some updating.
Yeah.
Well, those details are very helpful, I think. I want to, since we only have a minute or so left, I want to remind folks that the Health and Wellness Expo is Saturday, February 1st at the Forum from 10 to 2.
10 to 2.
It's free, a lot of good information there, it sounds like, and if you have missed it, if you're hearing my voice after February 1st, Look for the event site on Facebook, because a lot of the vendors are listed there, and you can get that information that you need. And then look for the expo next year, which will be about the same time.
Yes.
Well, I have learned a great deal today, so
Awesome.
I'm always grateful to learn things. And congratulations on your program.
Thank you.
And on your personal achievements. And,
Thank you.
You have to come back and update us.
I'd love that. Thank you for having me.
No, thrilled to have you. Thank you all for being with us on Community Watch this week, and we will see you next time. Bye now.